Hello, I'm Phil Hope, Minister of State for Care Services and Minister for the East Midlands. I'm sorry I can't be with you in person today, but I hope that all of you have had a stimulating and productive day, and that you've had plenty of opportunities to identify ways of driving forward the valuable work which has started over the last 12 months to ensure that the third sector engagement in the health and wellbeing agenda continues apace. As you know, this is a partnership event aimed at bringing together the third sector and health and social care partners to look at the current opportunities and the challenges for health and social care, and to seek solutions and answers to a crucial question. How can the third sector and the statutory sector work together to improve the quality, the value and the reach of health and social care services? More specifically, the key issues are: how can we work better together to reduce health inequalities? And what role can the third sector, the health and social care network, play in supporting this work? Well, I hope you have all had opportunity to reflect on these questions and have identified some innovative and creative ways of moving forward, so that we can continue to build upon the strong partnerships we have with the third sector here in the East Midlands, because we all want to make a really positive impact on addressing health inequalities for our region. One of the most fundamental tasks that the third sector undertakes is to ensure that the voices of individuals, the voices of organisations and of communities as a whole, often from the most marginalised sections of communities, that those voices are heard. In this way, the sector is vital to making our society fairer, and I think can play a critical role in actually tackling entrenched health inequalities. I think the third sector holds a unique position in its level of understanding of local issues and an appreciation of the factors that contribute to local health inequality. Third sector organisations help to influence the debate about local needs, can provide valuable perspectives and insights as to how those needs are addressed. Moreover, the size, the diversity of the third sector presents many opportunities. Its scale, its diversity gives it unique flexibility and reach, enabling third sector organisations to tackle social problems and their causes that the public and private sectors on their own may be unable to address effectively. The potential and the scale of ambition among existing third sector providers is significant, and we need to recognise the need to work together to harness those skills, the knowledge, the expertise which the sector offers. At a national level, the Third Sector Strategic Partner Programme was launched last year, and work has commenced with a group of 11 organisations to develop the support needed for third sector organisations to build on their skills and knowledge to improve health and social care services and act as advocates, as well as ensuring input from the sector in developing our health and social care policy. I'm pleased to say that OneEastMidlands, as one of the 9 regional networks that form Regional Voices, is an active partner in this programme, and I'm delighted to see the progress at regional level in joining up and engaging the sector in health and social care. The next stage review, the NSR, set out the vision to put quality at the heart of everything the National Health Service does. But since it was published, there has been a severe financial downturn and a forecast reduction in public spending. So the challenge now is to deliver efficiency savings through quality. We've got to maximise innovation, maximise prevention. Now, this challenge isn't one which can't be addressed through a national programme or a set of top-down initiatives. It needs input from right across the healthcare system and its partners across all sectors. And I think there's great potential for the third sector to support this challenge, given its track record of providing high quality, innovative and cost-effective services. So we need to find ways of ensuring that organisations are able to respond and work together, and I think that networks like OneEastMidlands have got a critical role to play in this. Across the Department of Health, work with policy teams is ongoing to understand and embed the role and potential of third sector organisations in the delivery of our objectives. This work is happening with world-class commissioning. It's happening as part of the review of the Joint Strategic Needs Assessment Development Programme. It's happening in system management. It's happening in personal health budgets. And it's happening in seeking ways to engage with and support the role of smaller organisations and groups for those with long-term conditions. And it's a part of our high-quality care for all innovation programme. The Office of the Third Sector describes the third sector, and I quote, as a diverse, active and passionate sector. And as a former third sector minister myself, I know that that description certainly applies to our East Midlands organisations, where the third sector comprises more than 35,000 groups and organisations with reach into every community. And of that 35,000, something like 42% of them provide delivery directly against health-related issues, and the figure goes up to 55% when social care is included. In addition, the sector contributes indirectly to the well-being of the region by increasing skills and aspirations, by providing facilities and focus for community activity, and by empowering people to make changes for themselves that improve their own lives. Here in the East Midlands, the Directorate of Public Health and Social Care has started some important work over the past 12 months to harness the potential of working in partnership with the third sector to influence health and social care delivery and to address health inequalities. And I think some excellent progress has been made. The commitment I would like you all to take forward from today's conference and our joint challenge is to start to plan the next steps to really build on and embed some of the great work which I know has started this year as a result of the relationship between the third sector and the health and well-being sector. We need to make a dynamic impact on health inequalities and on the wider health and social care delivery right across the East Midlands. In essence, it's vital that the sector is engaged proactively in the focus, in the design and in some cases delivery of services to ensure that local issues and barriers are identified and are overcome. By working collaboratively with health and wellbeing partners, we can ensure that funding and services target those experiencing most disadvantage and inequality in their health. We know this is a time of unprecedented change and possibility for the third and the public sectors. Never before have there been so many opportunities for the third sector to work alongside government towards shared goals, and I look forward with interest to watching how this develops in the East Midlands. And I'd like to take this opportunity to thank you all for your unstinting commitment to trying to improve health and well-being of people in the East Midlands and for your contributions to this conference today.